Hi everybody. Today we are going to look at some of the superficial and deep muscles of the body. We will be looking at the face and neck, the trunk, as well as the upper and lower limbs. Again, do keep in mind that we're only looking at very few of the muscles that we have, and we of course we're not looking at the 600 total muscles we have in the body. So we're keeping it simple. Now, before we do that, a few points that I need to make. First of all, every time you look at a muscle, you do need to remember that a muscle has two type of attachment. One that is identified as the origin, which is less movable bone within the movement of the skeletal muscle. And the insertion of the muscle is the bone that will be creating more movement during the muscle contraction. So when we're looking at the muscle action, which basically put is what is the function of that muscle, some of the terminology that you see here comes into play. Now, if you guys look at the handout that was provided through your Canvas page, you notice that these vocabulary is still listed, but here is a little bit more detail compared to what we have. So first of all, when we're looking at the action or motions of the muscles, they usually come in pair. So for instance, if you're looking at the movement of your feet, we have dorsiflexion versus plantar flexion. These are basically dorsiflexion implies that you are lifting up your toes versus plantar flexion is moving your toes downward. Kind of like when ballerinas are walking or tiptoeing, and that's plantar flexion. In relation to your feet, you also have the word inversion versus eversion. Inversion, as the word implies, it's moving your feet inward, where the sole of your foot is pointing inward. Eversion is where the sole of your foot points outward. And you can see it again in this picture we have here. So in eversion, your feet is moving more laterally, or the sole of your foot is pointing outward, versus inversion, the sole of your foot is pointing inward. Again, dorsiflexion is moving your toes up, and plantar flexion is moving your toes downward. Other words that we have is protraction versus retraction. Protraction is moving a structure anterior versus retraction is moving them posteriorly. Best example we can find for protraction and retractions are associated with the shoulders and mandibles. So let's take a look at that one. So when you kind of relax and you kind of stretch your chest muscle, what you're doing is you're retracting your shoulder or your scapula. And then you're kind of slouching, what you're doing is you're protracting your scapula and your shoulder. And here is another depiction of protraction versus retraction. You protract your mandible, moving your jaw inward, versus retracting it, you move your jaw inward. Other vocabulary we have is elevation versus depression. Now that those two words are self-explanatory. Elevation implies you lifting something up versus depression moving something down. Again, elevation can be also applied for the mandible and shoulders. So if you are opening your mouth, your mandible is being depressed because it moves downward. And if mandible is elevated, then you're basically closing your mouth. So again, depiction on the picture, elevation causes the mouth to close, depression of the mandible causes your mouth to open. And elevation versus depression, kind of like when you say you kind of move your shoulder up as, let's say, quote unquote, I don't care. Moving your shoulder up is elevation, bringing them back down is depression of the shoulder. Other vocabulary we have is rotation versus circumduction. And rotation is pivoting action around the axis. So when you shake your head no, so side to side, you're moving your head or pivoting your head around the axis of your vertebral column versus when you do Circumduction, what you're actually creating is a circular patterns. So if you think about your head, you can create rotational movement with your neck. You can also rotate your shoulder or rotate your legs. So again, if you're looking at the picture of circumduction, creating rotational movement versus rotation, circumduction is creating circular motions versus rotation is moving around the axis of your neck, again, creating that action of shaking your head no. You can have rotation for your leg as well. So if your foot is facing forward, that's basically your normal. If you move it to the outside, that's lateral rotation. And if you push it or move it back to the original position, that's a medial rotation. Some of the other words we have is pronation versus supination. Pronation is when the hands is turned downward or you're sleeping on your belly. That's the prone position. Supination is when we have the palms facing outward. You're basically lying on your back and in this case, supination also implies that your bones of your arms are parallel to each other. So I'm going to show you on this picture. So when you are in a supine position in terms of your arms, the two bones of your radius and ulna are parallel to each other. However, when you are in a prone position for your forearm, your radius is actually laterally rotating on the ulna, creating the prone position. Couple of other words that I have depicted here for you is extension versus flexion. Flexion is decreasing a joint angle versus extension is increasing the joint angle. So you see flexion and extension in case of your elbow, in case of your knee, and you can also think about them as your fingers when you flex your fingers and you close your fingers versus when you're opening them up, that's extension. And the other movement we have is abduction versus adduction. Abduction is moving the limb or structure away from the midline of the body. Adduction is bringing it back toward the mid-body. So if you are abducting your hand, you're moving it away from the body, and adducting it, you're bringing it back. Again, look at the word abduction. Abduction means taking something away. You can also do abduction, adduction with your lower limbs, moving your leg outward or inward. You can use the word abduction and adduction for your fingers. So when you do jazz hand, you're opening up your fingers and pulling them apart from each other. That's abduction. But when you bring all of your fingers together, that's adduction. Now, let's go ahead and look at some of the main muscles that we have in our body. Again, by no means these are all the muscles we have, but it helps us get an idea of some of the essential muscles. So starting with the head and neck, we have these muscles that has two separate sections connected with a very broad tendon, which we call aponeurosis. Now, because this aponeurosis is associated with the cranium, it's called the epicranium or epicranius. And the muscle that is forming or covering the frontal bone is called the frontal belly or frontalis. And the part that is covering the occipital bone is called occipital belly or occipitalis. The muscle on the side of your head that covers the temporal bone is called the temporalis. And coming forward, the facial muscles, we have muscles that are surrounding the eye in a circular fashion. So we call these orbicularis oculi. Orbicularis implies that it is circular, and oculi means it's associated with your eyes. We have a similar round muscle or circular muscle around the mouth. which we call orbicularis oris. Oris implies its relation to mouth. Covering the mental process, which is basically your chin, you have a muscle called mentalis, and a muscle that is going from the or originate from the zygomatic bone and coming further down into your facial muscle. That's called the zygomaticus muscle. Please do note that the zygomaticus muscle is a two-headed muscle with a minor head and a major head. But for your purpose and because of the lack of access to good muscle models, what I do want you guys to be able to identify is only zygomaticus without identifying the major and minor heads. On the side of your face, you have a large muscle called the masseter, which is involved in the process and movement of the jawbone or mandible. And the next muscle we have is this muscle that starts from the mastoid process of the skull and goes farther down into the thorax and connecting to the sternum and the clavicle. Now, because of the point of insertion and origin, mastoid process, sternum, and clavicle, you basically put all three of them in the name, and we refer to that muscle as sternocleidomastoid. Again, sternum, clavicle, and mastoid process. And you have a large muscle in the posterior aspect of the neck going down your back called the trapezius. Deep to trapezius, you have a muscle called the splenius, and this is something you also can see on the next muscle as well. There are other muscles, of course, that are listed here. They are interesting for you guys to know. However, it is not something that you will be tested on. Now, going down to the neck area, we have the two-headed muscle we already talked about, which is your sternocleidomastoid. Again, you can see the mastoid connection, the clavicle, and the sternum. We also have the muscle that is underneath our chin, that is called the digastric. Again, this is a two-headed or two-section muscle. Here is one belly, which is called the anterior belly, and the posterior belly. But again, for our purpose, you only need to identify that as digastric. You also have muscles that are extending from the hyoid bone to the sternum. And based on the original insertion of this muscle, we refer to this as sternohyoid. Now, again, please notice that there are more muscles involved in this process. However, these are the ones that I need you guys to know for your course. Moving further down into the trunk, the thoracic cavity, there are multiple muscles. And again, we're going to look at both the deep and the superficial muscles. So the superficial muscles on these models are depicted on the left-hand side and or the right-hand side of the model, and the deep muscles are depicted on the left-hand side. Now, understand right here that these are my ribs right here, which basically makes this side the deep side and this side the superficial aspect. So the most superficial muscles of the chest is called pectoralis major. And if we remove the pectoralis major, what we have underneath that is multiple muscles that two rows runs between your ribs, and it has the name internal intercostals and external intercostals. So internal and external intercostals, and you can see there's patterns or different patterns to these muscles. These muscles are running this way versus the external oblique are running this side. We also have another set of muscles right here, which are called the pectoralis minor. So if you remove the pectoralis major, underneath them, you should see pectoralis minor. And on the sides of the thoracic cage, you see muscles called the serratus anterior. This should sound familiar to you guys since we have discussed these muscles in terms of their terminology and their naming. Serratus anterior has this seesaw pattern on the side, and again, they are more toward the anterior aspect, therefore we refer to these as serratus anterior. So in this muscle, if you're kind of going to get some practice, you have your pectoralis major, you have your internal intercostals, you have your external intercostals, you have the pectoralis minor, and on the side you have the serratus anterior. Going farther down into the abdominal region, at the center we have the rectus abdominis muscles, which the pattern clearly sees is straight. Right in the middle of the rectus abdominis, we have this white fascia called linea alba. On the sides of the rectus abdominis, on the most superficial aspect, we have external oblique. And if we remove the external oblique, we have a layer of muscle underneath called the internal oblique. Going down to the arm, so right here, what we have is the muscles, and separating or visualizing this, right here is the spine of the scapula. So that kind of gives you an idea that basically this is your shoulder girdle, which means that underneath this area, this would be where your humerus would be located, and again, this would be your scapula. So scapula coming into your humerus, forming your shoulder girdle. So what are the muscles we have here? Now, if you recall, if this was the spine of the scapula, the region right on top of the spine was called supraspinous fossa, and the area immediately below the spine of the scapula called infraspinous fossa. So the name of the muscles are very similar. So the muscle that is on the top of the spine is called supraspinatus, and the muscle below that would be infraspinatus. We also have another muscle called teres major, and right here you can see another muscle which is called teres minor. We also can see this triangular muscle right here, which is right on top of your shoulder. This is where a lot of the injections, if you're getting it in your arm, takes place. And this is your deltoid muscle. Here is the same model. What we're looking at is we're looking behind the model. So this is, or more specifically on the other side of the model. So this is the anterior surface of the scapula. If you recall from your skeletal system, this surface was called subscapular fossa. So the muscle that is covering this surface is called subscapularis. Again, here is your deltoid from this view. Now, if you're looking at the positioning of the arm, deltoid is coming into contact with the muscles that is forming the anterior portion of your arm, which is the bicep brachii. Again, understand the word biceps implies two heads. So just simply saying biceps have no meaning other than that muscle has two heads. You need to use the second part of the word, which is brachii, to identify that this muscle is associated with the arm. Now, underneath the arm, or more inferior, you have your triceps brachii. And again, triceps implies that this muscle has three heads. I don't expect you guys to identify the three heads, but the three heads are known as lateral, medial, and long heads. Sitting between these two, you have this muscle right here in the medial aspect of the arm called the crocobrachialis. And again, we already identified the deltoid. Now, if I go ahead and remove the biceps brachii, which is what you're seeing right here, there is a muscle underneath that, and you can actually see the humerus now right here poking out. This muscle is called the brachialis. And again, note that it says it is deep to the biceps brachii. Now, going to the forearm region, you have muscles that are identified as extensors and flexors. So if you look at your arm right now, before even actually going into extensors and flexors, what you kind of want to see from this picture is that this top portion right here is basically your arm region, and this is your forearm. So this is basically where you usually get your blood drawn. It's an area where two muscles are merged together or converge together. The muscles that is running on the side of the thumb, which is right here, is called brachioradialis, because as you can see, this muscle starts from the arm region and runs on the side of the thumb. So we know the muscle, the bone underneath the thumb is or on the side of your thumb is the radius. So this muscle starts from the arm and runs on the side of the radius, and therefore is called brachioradialis. Opposite to that, you have a small triangular muscle, which is called the pronator teres. Now here, this is a little bit more detailed than what you guys are expected to know. What I would like you guys to understand is that the muscles that are forming on the supine position of the arm, which is basically, I would say, the area where you have no, or you should not, or you typically don't have hair. So that side are the muscles we call or classify as a group are called flexor muscles. Now, flexor implied the action they create is flexing the wrist. So flexor carpi implies these muscles are again flexing the carpal bone, and we know that the carpal bone implies your wrist. Now notice again, I don't want you guys to know this detail, but it is interesting to just kind of take a look at this. So what we have is the flexor carpi ulnaris on the side of your pinky. So underneath here would be your ulna. Right in the middle, you have the muscle that is branched to basically supply the palm. That's palmaris longus. And then further into the radius bone, or running on the surface of the radius, you have flexor carpi radialis. But again, for this side, all you need to know is the muscles that are located on the supine position. When you put your arm on the side of your palm, those would be referred to as the flexors, as in they have the capacity to flex your wrist. Opposite of that, you have muscles that are called extensors. Now, these muscles are giving you the ability to extend your wrist or create the action of extension. Now, notice that there are a number of these muscles called extensor carpi ulnaris, again on the side of your pinky, extensor digitorum that extends to your fingers. And then you have two extensors associated with your radius called extensor carpi radialis brevis and extensor carpi radialis longus. And you're going back to the whole brachioradialis, which is what you started with. So again, for your knowledge, you only need to identify this group as extensors. Now moving down to your leg. So this picture is depicting the muscles on the posterior aspect of the lower limb. To kind of orient yourself, here is your ilium, which is basically the superior part of your os coxa. Right here would be your sacrum and your coccyx bones right here. So right here we have two major muscles that are basically forming the posterior aspect. The largest one is the gluteus maximus, and the one on the side or on the lateral aspect of the ilium is gluteus medius. Going farther down, what you have is muscles that are forming your hamstring and are not labeled here, so I'll show you on the next picture what these muscles are. I'm gonna move forward. So your hamstring muscles are three main muscles called biceps femoris. Again, here is the word biceps, which implies basically two-headed muscle associated with the femur, semitendinosus, and semimembranosus. So if you're looking at your lower limb or your thigh region, basically here is the medial aspect. So on the medial aspect, we have the superficial muscle, which is semitendinosus, and deep underneath that, which is poking out right here and right here, is semimembranosus. On the lateral aspect of the thigh, or posterior aspect of the thigh, we have the biceps femoris, which is right here. Again, biceps femoris stands by itself. It has two heads, the long head and short head, and the muscles on the medial aspect of the thigh, we have the more superficial one, which is semitendinosus, and the more deep one, which is semimembranosus. Semimembranosus can be visualized from this side, on the more of the medial side, as well as the lateral side right here. Now, if you look at the anterior aspect of the thigh, there are multiple muscles you need to know. One of the ones that you probably have used in common terminology or when you work out is quads or quadriceps. So quadriceps imply that there are four muscles involved. The proper terminology for these four muscles is quadriceps femoris, as in again, four muscles associated with the femur. What are these muscles specifically? We have the muscle that runs in the middle. This is a straight muscle called the rectus femoris. And we have two muscles on the side. If it's on the lateral aspect of the thigh, it's called vastus lateralis. And if it's on the medial aspect of the thigh, it's referred to as the vastus medialis. Last muscle we have, again, this is a quadriceps, as in you will have four muscles. The last muscle is underneath the underneath the rectus femoris, and that's called the vastus intermedius. Vastus intermedius, and that's right, the name is right here. So rectus femoris, vastus lateralis, vastus medialis, and underneath your rectus femoris, you have the fourth one called vastus intermedius. On the medial aspect of the thigh, you have another parallel muscle that is called the gracilis, and another muscle that starts from the lateral aspect of the thigh and goes into the medial aspect of the knee. This is a relatively thin muscle called the sartorius. We also have a muscle connected to the pelvic bone called the pectineus, and adductor magnus and adductor longus and adductor magnus in order. So these are the muscles that form the anterior aspect of the thigh. Your quadriceps, your sartorius, your pectineus, adductor longus, and adductor magnus. Here's a depiction on a model for you. Rectus femoris right at the center, with vastus lateralis on one side and vastus medialis on the opposite. And if I remove this muscle underneath that, you will have your vastus intermedius. You also have the three muscles here. They're not labeled, but it is good for you guys to know. Right here, you have pectineus, followed by adductor longus, followed by adductor magnus. Medial aspect of the thigh is your gracilis muscle. And the one that I didn't mention before, but I do need you guys to know, is a muscle that runs on the lateral aspect of the thigh with a very pronounced tendon, and this is called tensor fascia latae. Tensor fascia latae. And you can see that a little bit better on this picture. You can see it running on the lateral aspect of the thigh. And again, you can see a very pronounced fascia right here on the side, hence the name tensor fascia latae. Going farther down, we have the muscles that forms the back of the leg. These are two main muscles. The superficial muscle we have is called the gastrocnemius. A lot of people use the word calf muscle for it. Now notice that it has a very pronounced tendon right here, and this tendon is what we identify as the Achilles heel. So if there is any damage to that, basically you lose the function of doing any type of movement with your foot. And then deep to the gastrocnemius, what you see poking out right here on the side is a muscle called soleus. Lastly, if you look at the anterior aspect of the leg, we have the very pronounced tibia right here. Covering the tibia partially is the first muscle you need to know, which is called tibialis anterior. And again, the name comes from the fact that this muscle sits in front of the tibia. And further, going more laterally to the tibialis anterior, you have extensor digitorum longus, which allows the leg, allows the foot movement. So that's about it for our muscles, and we'll continue with our next lecture.